Good afternoon, everyone, and welcome to today's event, What Should Kids Eat? Ultra-Processed Foods and Children's Health. This is hosted by the National Academy of Medicine. I'm Megan Ranney. I'm honored to be your moderator for this important and very timely conversation. Today's webinar is part of a new series, Health in the Headlines, which was launched to help the public better understand high-profile and sometimes controversial health issues through the lens of science. In an age of information overload, media noise, and polarized debate, it can be difficult to know who to trust, what to believe, or how to interpret the evidence. This series aims to cut through that noise. Over the course of the year, we're going to hold a series of sessions, each of which will bring together leading experts to share both what the science tells us and, just as importantly, to model a kind of public dialogue that acknowledges uncertainty, respects differing perspectives, and distinguishes between evidence and values. Our goal is to promote trust in the scientific process and empower all of us with clearer, more transparent insights into the issues that affect our health and well-being. So, over the course of the next hour and a half, you may hear our speakers identify not only what the science says, but also where personal or policy values come into play in how we design, interpret, or use the evidence that we're reading. So with that as prologue, today's event, of course, is about ultra-processed foods, also known as UPFs, and their relationship to kids' health. I will say we planned this not knowing that the MAHA report was going to come out yesterday. You will doubtless hear little bits about it over the course of the next hour and a half, but the discussion would be important today whether or not that report had been published yesterday. We know that UPFs have become a central part of how we eat in America today. And for kids in particular, they've come to dominate diets in ways that raise concerns for researchers, clinicians, caregivers, and communities. So today we'll talk about what does the science really say about ultra-processed foods and children's health? Where is there agreement? Where is there real debate? And how can families, health professionals, and the public make informed choices? I also hope we'll talk a little bit about where the science needs to go next. So with that, I'm going to move into introductions for our outstanding panel of speakers. I will note all of them have conflict of interest disclosures that appear below the video player on the NAM event page. And I will also say before I go into intros that I invite all of you to participate. Please submit questions through Slido, which you'll find embedded also below the video player on this page. And note that the event is being recorded and you'll all receive a link to the recording when it's available. Last small kind of moderator note is that for those of you who do want continuing education credit, make sure you complete the short survey that's linked below. It'll stay open for 30 minutes after we conclude. We all know we need our continuing education credit, so take advantage of it. With that said, let's dive in. I'm going to ask each of our four amazing guests to introduce themselves and tell us a little bit about their background with ultra-processed foods and kids' health. Including a little bit of their primary goals or values that have driven them to work in this area. And I'll start by modeling. So for those who don't know me, my name is Megan Ranney. I am an emergency physician and dean of the Yale School of Public Health. I'll say that I'm excited to moderate this because as a public health researcher, as an educator, as a physician, but also as a mom, I know that nutrition is a cornerstone of good health for people of all ages. And I've watched us be stymied for too long in acting on what we do know about nutrition science. I believe we need both structural solutions, things like government policy, and individual empowerment to improve our options in this country. But I, like many of you, have been confused by some of the science that's coming out and understanding what we can do to act on it. So I'm excited to be in conversation with these four folks who are true experts. With that, Christopher, I will turn to you to introduce yourself and tell us a little bit about you.
Thanks, Megan. Happy to be here with these distinguished colleagues. I'm a professor of medicine and have my PhD in nutrition science at Stanford University. I had the honor of working for 2 years with the distinguished Dr. Fatima Stanford on the Dietary Guidelines Committee. And we took some flack for kicking the can down the road on that. And so that hopefully will be an interesting part of the conversation in terms of evidence. At the same time we were doing the Dietary Guidelines Advisory Committee, the American Heart Association was working on a scientific advisory that just got released last month. Kevin played a really big part of that. And that actually got into lots of details. And since we put our names on lots of details, we got flack for that too, for having lots of details or no details. I've really been taken with David Kessler's approach to this, the ex-FDA commissioner, who thinks of this more as ultra-formulated food than ultra-processed food. That might help our discussion today, and I'm happy to cover that later. Thanks for letting me be here.
Thanks. That distinction between UPF, highly processed, ultra-formulated, I am sure we will get into some discussion of. Kevin, well, that's a great segue into you.
Yeah, thanks. Thanks very much. It's a pleasure to be here with everybody and an honor to be invited to participate in this. My name's Kevin Hall. I'm a nutrition and metabolism scientist who spent a little more than 2 decades at the National Institutes of Health in their intramural research program, leading basically a series of studies to try to better understand obesity. And more recently, we got into interesting mechanisms by which diets high in ultra-processed food might lead to excess calorie consumption and weight gain and body fat gain. And in terms of values, I believe that the most rigorous science provides the ultimate reality check on our preconceptions and pet theories that often bias our decisions and our actions. And I think for much of the conversation around ultra-processed food, that has been a leading role in driving some of those conversations and not relying on the science so much.
Thanks, Kevin. I think you in particular, I'm going to be looking to for some discussion about where you wish you could go next in your science. Were you still at NIH? Susan, can you tell us about yourself?
Sure. I'm really pleased to be here today. I spent 3 decades in academic research and teaching at the Yale School of Public Health. My work all involved nutrition and chronic disease prevention and management. I was then recruited to join the FDA as director of FDA Center for Food Safety and Applied Nutrition during the Obama administration. I ended up staying through the first Trump administration and through the first part of the Biden administration, where I got to work on translating nutrition science into policies to improve public health. And then I retired in 2023 and rejoined the faculty at Yale now as an adjunct professor. I believe very strongly that nutrition is one of the most important modifiable risk factors for chronic disease. I've been working on this for decades. And while nutrition science continues to evolve, I know we're going to talk about some of those research needs. I really think it's important that we take action now on areas where the science is settled and where we can begin to improve public health. So it's a pleasure to be here with you all today.
Thank you, Susan. That dance between science and policy is a real one, and I look forward to your expertise on regulatory affairs. Thank you. And last but not least, Fatima.
Hello, everyone. I'm Dr. Fatima Cody Stanford. I'm an obesity medicine physician scientist at Massachusetts General Hospital and at Harvard Medical School. I am one of the first fellowship-trained obesity medicine physician scientists, and I'm also an internist and a pediatrician. But I want to take you back to my journey in Atlanta, where I first began to really explore nutrition in the late 90s, early 2000s, working with Dr. Ken Resnicow on projects like Healthy Body, Healthy Spirit in Black church communities. Where we really were exploring this idea of intersection of nutrition and the faith-based communities, and then also looking at issues and communities of looking at overweight and obesity in Black girls with the Go Girls program and things of that sort. My parents and my maternal grandmother started a food pantry and clothing bank in the late 90s, and they just were actually named and honored with that food pantry just recently. And I started to think about this idea of how nutrition and food insecurity, housing insecurity begins to interlink. Christopher knows that this is something that I talked about in our time as members of the Dietary Guidelines Committee, and how we can't disconnect these idea of chronic disease like obesity with food insecurity and housing insecurity. And so this is something that I start thinking about in the late 90s and has carried me to the work that I do today as a physician scientist, using, of course, different tools like pharmacotherapy, metabolic and bariatric surgery to intertwine with the work that I think about in nutrition, thinking about my colleagues that are doing this work like Dr. Kevin Hall and Dr. Christopher Gardner, particularly in the nutrition space. And so it's really going to be really great as we think about this. I did help lead this work on ultra processed foods as we, as Dr. Gardner said, kick the can. And I really don't think we kicked the can. We looked at what was available in the literature on ultra processed foods for both children and adolescents and for the adult population. And unfortunately, the literature is relatively scarce. And unfortunately, when we're looking at the different classifications, particularly the NOVA classification, which is most likely to be used in terms of evaluating ultra-processed foods, we find that there are some considerations that we have to evaluate in determining, okay, what is considered ultra-processed? Is all ultra-processed bad for you? And then what do we do with that in terms of looking at the health of our nation, and particularly for our children, which was our focus for today. And so it's a delight to be here to discuss this with my esteemed colleagues.
Thanks, Fatima. I think when I posted about this discussion on social media, it was one of the questions that I got most often is why are you guys are saying that on the one hand, ultra processed foods are bad, but on the other hand, we're not quite sure how to classify them, which actually will lead me then to my very first question for all of you, which is what are ultra processed foods? How are they different from other foods? Are there more now? Kevin, do you want to lead us off on this discussion and then I'll welcome others to jump in?
Sure. So I think, as was just mentioned, ultra processed foods are typically defined by the NOVA classification system. This was a system developed by Carlos Monteiro and his team at Brazil. And it was a really unique way of kind of looking at foods, very distinct from the sort of traditional nutritional profiling methods that many countries have used to kind of rate the overall diet quality of foods. And it's based on primarily on their formulation in terms of industrial ingredients not typically used in restaurants or home cooking. It has a much longer definition, but that's the sort of summary and practicalities of how many people are evaluating whether or not a food belongs in this category 4 of the NOVA classification system is, are there ingredients in there that are not typically used in culinary preparations in either restaurants or home cooking. And of course, there are a great many of those kinds of ingredients that our food manufacturers use to increase shelf life, to make the foods more convenient to be heated up in a microwave as a ready-to-heat meal or something like that. And I think it's really important to note that even according to this NOVA system, it's a very broad category of foods, right? And while there are many that are likely to be unhealthy according to their nutritional profile, so the typical things like high in saturated fat and sugar and sodium and low in fiber and whole foods like vegetables and fruits and that sort of thing, legumes, there is not complete overlap between what we don't normally think of as a nutritionally deficient sort of food and an ultra processed food. And some of those foods may actually be healthy. And in the UPF definition itself doesn't really determine whether or not a food is healthy or unhealthy. And it also doesn't specify the mechanisms by which a diet that might be high in ultra processed foods might cause poor health. Those are empirical questions that need to be studied with rigorous science. Now, that being said, there's a great many nutritional epidemiology studies that have linked diets high in ultra processed foods, according to the NOVA classification system, with poor health. My research team, I'm not a nutritional epidemiologist. I'm a sort of a basic physiologist at the human physiologist. We were really interested in understanding mechanisms of obesity because a kind of a very often link that's been made between diets high in ultra processed foods is that it increases your risk for obesity. And we conducted the first randomized clinical trial to find out if two very artificial food environments in the NIH Clinical Center, where people lived with us for a month, where we matched the overall calories and the various nutrients in the diet, the macronutrients, the salt, the sugar, the fiber, but we varied these two food environments widely in the amount of ultra-processed foods that were available, whether or not those led to differences in calorie intake and body weight. And importantly, we asked the study participants not be trying to gain weight or lose weight, just eat as much or as little as they like. They didn't know that we were measuring their leftovers and calculating, exactly what they ate. And so we published the results of that first study in 2019. And what we showed was that the high ultra-processed food environment led people to overeat and gain weight, whereas the minimally processed food environment led those same people to basically spontaneously lose weight and consume many fewer calories. And so since that time, we've been working to try to identify the specific mechanisms. What are the properties of ultra-processed foods and diets or environments high in ultra-processed foods that drive that excess calorie intake effect? We've been having some success in understanding those mechanisms. We did finish a study recently, even after I felt compelled to retire from the NIH in April, but we're working with the team still to kind of get those results out there.
That's great, Kevin. Thank you. And I think even just in that brief introduction, you highlight some of the things that, again, with a caveat that I am not a nutrition researcher, right? But as I've been researching, kind of prepping for this webinar, kind of the challenges with how you define UPFs and the differences in ways that we think about this NOVA classification versus nutritional value. Some of the challenges in the way that we measure health effects, that a lot of it is nutritional epi, which I'll get to with Chris and Susan and Fatima, but all those challenges of causation, not correlation, right? That we have a lot of retrospective studies that have all kinds of biases in them. And then what you were just talking about is that you measured in a really nicely designed set of studies the impact of these highly processed or ultra processed foods on obesity. But a lot of the discussion today is about more than just obesity, right? It's about how these foods affect our health in lots of different ways. And if you read the Maha report yesterday, right, there's thoughts about how does it affect our cancer rates, our mental well-being, and so on and so forth. So I want to go a little more into the science. Just for those who are watching, we're going to spend the next probably 20 minutes or so talking about the science and what we know and don't know before we get to some practical implications. So I'll open it up to, I think actually, Chris, I'm going to go to you on talking a little bit more about the science and what we know and don't know about what quote unquote UPFs do for our health, particularly for kids. Right, we've talked about kind of behavior and attention span, right? Everybody says eating sugar causes kids to have ADHD symptoms. Can you talk a little more about that part of how we think about ultra-processed foods?
Sure. And this is why Kevin is such a rock star in this field, is because to phrase this question, think of the different ways you could phrase it. So you could, in science, draw some balance between rigor and generalizability. Rigor leads to a more solid statement, but it might not be very practical. And rigor in nutrition science is usually how many things do you match and how many things do you let vary. So imagine forcing the calories to be exactly the same and seeing if you gain weight on one diet versus the other. Well, that would be weight. So it's something other than calories going on here. Or there was actually a really interesting ultra-processed versus less processed randomized trial that just got published a month ago. And interestingly, even though in Kevin's study on ultra-processed food, they gained weight, in this particular study, they lost a little weight in the ultra-processed arm. And so some people were scratching their head, and it didn't actually take long to look into the details. The devil's in the details here. They had picked only the healthiest of ultra-processed foods. This is a study out of the UK. And the hypothesis was, if you picked only the healthiest of foods and increased it, what would happen? And in terms of weight loss, the minimally processed group lost twice as much weight, which was really only 1 or 2 kilos, I can't remember. And the ultra-processed group didn't gain weight, but they only lost half that much. But we're not expecting people to eat only the healthiest of ultra-processed foods. We're expecting them to eat more of what's out there and what's being marketed to us. So when we're trying to pull apart the science and see the headlines and see why the public's confused, it's pretty hard, Megan, to wrap your head around, did they match the calories? Did they not match the calories? Did they only pick the healthiest of the ultra-processed foods? Was it an insane number of ultra-processed foods, like 90%? Was it an unachievable amount of ultra-processed foods, like 10% or 0? From a scientist's perspective, those are all really powerful tools. Wow, I can design this study to isolate the question in this way. And then as you turn that back to the media, who says, oh, you finished your study. I need this in a soundbite. What happened? Who won and who lost? Wait, that's not the same as what happened yesterday. And I feel sad for the public trying to digest that information when in fact, it really takes going a little above and beyond to understand which tools were applied to answer the question And then the rest of us all try to put it all together and say the overall answer is this. And so I bet some of my colleagues can help with the overall answer, but I actually, as the nutrition geek, love, right, that opportunity to manipulate the different pieces of it. But sometimes I feel like it's a little disingenuous to the public to not to present these and say, sorry, I really manipulated this artificially so that I could answer this one question. I did a great job answering this one question, but it needs to go in the context of the practical nature of how people buy and eat food.
Well, and that's that tension in public health research, right? That if we control everything perfectly, we're not approximating real world conditions, but we can get closer to the quote unquote truth. When we do real world conditions, we've got all of our recollection bias or kind of all of the other factors that go into our health, which may be changing our health outcomes, that the food may be a marker of all of those other things rather than the cause, right? And I think that's where the more literature we can put together, the better. Kevin, Fatima, I welcome both of your responses to what Chris just said.
I really think that he brought up some really important points. We do try to come up with these sound bites, and we try to, think about this in terms of, giving the best answer for the media. And Megan, you spent a lot of time really intersecting with the media. I do have to spend quite a bit of time in that space too. And people want that answer, particularly reporters. Like, what's the answer? Give me the answer. And you're like, well, it's not that simple. We really struggle with this, particularly when, looking at the literature for the dietary guidelines. We were specifically tasked with addressing this idea of how do ultra-processed foods in children and adolescents affect this idea of growth, body composition, and risk for obesity. And people wanted the answer. And we had to give this statement that says that limited evidence suggests that dietary patterns with higher amounts of foods classified as ultra-processed consumed by children and adolescents are associated with greater adiposity. And what do we mean by that? We're talking about fat mass, waist circumference, BMI, and this risk for overweight. Okay, that was convoluted. That's not the soundbite that you want. But when we really looked at this literature, we only had, when really combing through the literature, 25 prospective cohort studies to look at. And there was a lot of issue with those cohort studies. There was issue with consistency. There was concerns with variation in the magnitude of effects when we looked at these studies. There was issue with precision. There was smaller sample size and wide variance in the studies. There was potential exposure misclassification in the studies. So when we're really looking at the data and really doing the nitty-gritty work, which is why we can give this lovely, wonderful, pretty answer that people wanted, it wasn't pretty. And so when we gave this limited evidence, we had to give this evidence based on the fact that there was concerns about applicability of this ultra-processed food question that we were trying to answer, when particularly most of the studies that we were drawing for weren't even from mostly the US population. But we were trying to address the US population, right? This is the US Dietary Guidelines Advisory Committee. We want to inform children and adolescents within the US population, but we're pulling from studies that were mostly coming from outside of the US population, which probably doesn't generalize very well to, hence, the US population. But as scientists, we want to make sure that we're informing with evidence that's actually based upon that population, the population that we're intending to give information about. So I think that hopefully this helps us understand that it's murky waters that we're in. And, in order for us to give an answer that really speaks to the population, we would need really a great RCT. We don't have a controlled environment like Dr. Kevin Hall had at the NIH, where we can bring all the children in and randomize them to two groups. But that would, of course, give us the best answer to the question that we're seeking to answer.
And at the same time, we have, parents and school districts that are looking for guidance, right? But we're trying to do it's the same thing as what we've done with vitamin A and measles, where extrapolating from low and middle income countries may not be the best idea here in the US. Kevin, do you want to reflect a little on what Christopher said and kind of on level of evidence? Yeah.
Yeah, I think it is. These are really important points, and I think that one of the ways I sort of like to think about the kinds of more mechanistic studies that we're doing is that they can't be held off in isolation and saying that this is the definitive study that will be the be all and end all of everything you need to know. We have to triangulate the evidence from all sorts of kinds studies. And one of the things I think is really interesting is that when you dive into some of the mechanisms, you end up uncovering things that we already knew, right? So one of the things that we are testing and have tested in this trial that recently wrapped up, but when we retrospectively analyzed our previous data, it turned out that certain factors that we highly suspected were important in driving excess calorie consumption are again appearing in this new context of ultra-processed foods. Things like the energy density of the overall meals, how many calories per bite essentially that is encapsulated in that meal. We've known from data from Barbara Rolls' group and many other people for decades that that factor plays a role. And now what we're seeing is that ultra-processed foods tend to be higher in energy density and therefore tend to be overeaten. So once we kind of understand the mechanisms, we can then start to put that new knowledge about ultra-processed foods into this broader context of the literature of what we already know. Similarly, we were observing that things like combinations of nutrients, foods that are high in both sugar and fat, or sugar or salt and fat, or even salt and carbs seem to drive some of the effect. Again, now we're getting back to the sort of nutrient profiling issues that we've long thought are important for health. And so I think, again, by kind of focusing in on the mechanisms and these really artificial studies, sometimes the kinds that we're doing, which are more mechanistic, is surprisingly, you end up getting information that puts the picture about ultra-processed foods into this more global context so that you don't have to hamstring the folks who are doing the Dietary Guidelines Advisory Committee to saying that, well, if we were able to address many of these nutrient things that we've known about for years, and we actually have much better data from longer term studies and whatnot, many of those factors may now be also mechanistically playing a role in why diets high in ultra-processed foods might be driving some of these problems.
And I love that discussion about the nutrient categories, and in discussions with folks that are registered dietitians or kind of, again, clinical nutrition scientists. That was something that's come up, again, as I've been prepping for this, that comes up a lot, is that discussion, is the question about what is the nutrient value, again, rather than how processed are these foods. I'm going to push a little bit. Most of our discussion so far has been about adiposity or obesity, but when you look at the popular conversation about quote unquote ultra processed foods, a lot of what we hear about is not obesity, although that is a real problem, but about all of the other chronic diseases that are thought to be a consequence of consumption of poor quality food. And Christopher, Susan, I'll bring you in here as well, given your background. Would love to hear what the science actually tells us about the relationship between food consumption and not just obesity, but also other long-term health effects. Again, cancer, mental well-being, attention deficit disorder, and so on. Whoever wants to take it, go for it.
Go ahead, Susan.
Getting off mute there, sorry. Yeah, so what I'd say, Megan, is that the chronic disease literature is largely based upon adults for obvious reasons. We don't have great cohort studies that start with early life nutrition and then move forward and study those chronic disease outcomes. But we do have a lot of data from adults. And we consistently find that these diets that are rich in fruits and vegetables and whole grains and certain types of dairy products, healthy oils, those predict reductions in cancer, in cardiovascular disease, in diabetes, and all the major causes of morbidity and mortality right now, including the biggest ones, cardiovascular disease. So we have to sort of extrapolate down, and some of that is based upon mechanisms as well as what we know. So if we take sodium as an example, we know that the mechanism for sodium, at least one of the mechanisms in terms of adverse health effects, is blood pressure. And so we are seeing increased hypertension in kids today. We overeat sodium badly in this country, way too much, and it's strongly linked with cardiovascular disease and stroke. And so while we don't have data specifically on cardiovascular disease and sodium in our children, the mechanisms are well known. It's plausible. We're seeing changes in blood pressure in our kids. And so I think there's policy to act upon that even with our kids without having that evidence. So that's an example, but most of the data is certainly based upon our adult population.
Thanks, Susan. Christopher?
Yeah, well, and so another challenging part in all of our research studies is what you pick as the outcome, Megan. So if you are going to pick cancer or heart disease, you're obviously not going to study kids. You can't say, hey, here's these kids and I'm going to wait till they get cancer or heart disease. What if it was ADHD or something psychological, or it was attention span in the classroom? That's another set of really interesting outcomes that other folks study. That isn't something that I study in particular. Those are sometimes very hard to control. Some of those are very subjective. Wildly, hugely important to parents of kids in our schools. And the challenge there is, if you wanted to study that, it's much easier to get a study funded that says we sure want to get kids to eat more legumes and vegetables and fruits, as opposed to, just in case it would hurt them, let's see what if I gave a whole bunch of kids everything that was neon green and blue, right? And had all kinds of emulsifiers, flavors, colorants, all the things. So the real definition, according again to NOVA, like Kevin had mentioned, is these cosmetic additives. And I think what's really got to be interesting for teachers and parents is those foods seem to be so obvious. There's multicolored marshmallows. You're spraying cheese out of a can. Who remembers pink slime from a decade ago? Of all these different, wow, this is really heavily processed food. It's got to be bad for our kids. Why isn't somebody telling us that this is bad for mental health or other things? And you'd have to do that study to find out. You can do the observational study that says, wow, the kids who ate the most of this had the most of that outcome. And you have to be very specific about the outcome, but chances are the kids that ate the most of that may have had issues with food insecurity, may have home and housing issues, family distress. There are a lot of things that come together. And so the food industry has a pretty easy time of jumping out and saying, wait, you can't blame that on us. There were a lot of other things going on. That would be unfair. Maybe I'm a mom and pop group that made the latest Cheezo Wizzos, and wow, don't take away my right to make a product that I want to sell to school kids. So a lot of tension there in picking that other outcome, Megan, of what that is. And are you flipping it to say, I want them to have less of that eating healthy things? Or are you going to really propose to study it by saying, wow, to make sure it's that thing, we're going to flip it and give our kids more of the thing that we're going to see if it hurts them, because we need to know if it's definitively that. That is hard to do in science. In fact, pretty much impossible.
And then we get to policy changes and all of us studying it afterwards. So for example, if we get rid of quote unquote synthetic food dyes and use quote unquote natural food dyes instead, and we still have a bunch of kids eating Skittles that just happen to be colored with red dye made from plants instead of from chemicals, are we actually going to see any change in obesity and other outcomes? That's where our great scientists can step in and design hopefully some nice studies that allow us to draw some causal conclusions while also describing outcomes. Fatima, you were kind of reacting as Christopher was commenting. And then Kevin, I'll go to you next. Yeah.
I think the issue is there's too many variables, right? Like you can't isolate. And I think that's what Christopher's talking about. There are too many variables to control for, right? They're like, how can you isolate and say, well, it was the Skittle. I mean, like, let's talk about what you were talking. Well, I don't want to call out Skittles. I mean, I guess it's the Mars company, right?
Yeah. I'm not using generic brand names
right,
here.
right,
So yeah.
right. But let's, it was the Skittle. Like what else was going on? Let's talk about the allostatic load within that environment, right? Let's talk about all of the different factors that played a role in driving that family with, I started off my introduction talking about housing insecurity and food insecurity. When we're talking about someone that accesses something like a food pantry, and one of the things that we've noticed, for example, in that food pantry environment is we can distribute all of the lovely fresh fruits and vegetables, beans, legumes, lentils, etc. But if you're housing insecure, where are you going to prepare those foods? Let's say you're living in and out of a housing shelter. Okay, so then we can give you a box of lovely, great fresh fruits and vegetables, but then you take that back to a housing shelter. That's lovely. Where are you going to do? Put that under the bed somewhere, and then prepare that where? With what? And with whom? With whom and with what and where? A lot of times it was very interesting. Something as simple as corn on the cob, when that was distributed to people at the food pantry, some of the people remarked, well, why is the corn on this thing, is what they asked my parents. Corn on the cob to me is a very basic thing that I assumed that everyone knew, that corn comes on a cob and then it has to be removed from the cob. But many of the people in the food pantry or attending the food pantry had never seen the corn, not like had seen it either in a can or something off of the cob, off of the cob. And so they were like, well, why is it on this thing? Why is it like, how do you get it off the thing? The cob is the thing. Very interesting thought process. So when you're starting to give them like, oh, well, let's give you bok choy and let's give you dinosaur kale and all these other things, they're like, what is this? And what am I going to do with this? And so we can say, oh, we're going to solve the problem by giving you this, but you have to look at all of the things that are surrounding what environment this person lives in, whether this is culturally appropriate, whether they can take this somewhere to do something with this. Well, like there's so many factors that play a role. Just saying, oh, I'm going to solve it by just dumping fresh fruits and vegetables, beans, legumes, lentils. I love to say that because Christopher likes to say that, into an environment and saying we've solved this issue of nutrition deficiencies in this environment. And hey, now this is going to be a nutrition rich environment. This is problematic. And we've seen this time and time again, as we've seen the quality of donations improve in certain areas, particularly within this environment in Atlanta where my parents are. Well, what can we do in this environment where we're individuals? And so what they see in the church parking lot, a lot of times after these are distributed, they see fruits and vegetables all in the parking lot as people dump it out. They can't do anything with it. And it's heartbreaking, but the reality is they don't know what to do with it. They have nowhere to take it. They have nothing. They have no way to prepare it. They don't know what it is. There's a lot that has to go into turning this into something that can actually be utilized by the individuals that are on the receiving end of these, particularly in these safety net scenarios. So
thank you. Kevin, Susan, you both have comments, and then I do want to move us into kind of that guideline process.
Sure.
And then from there to the practical, what can people out there listening actually do with this scientific mishmash that we're talking about? Susan, then Kevin, and then I'll move us towards kind of policy, regulation, and next steps on action.
Yeah, the thing I would add is I think a really important research need, and that is we've talked about some of these ingredients in foods, the cosmetic ingredients, the colorants, the emulsifiers, and the reality is we don't have a federal database that includes what's in these foods. And so if you want to do an observational study of kids or adults and ask, do people who consume more of this emulsifier have a different outcome than others? There is no database currently to be able to do that. And when we do even things like 24-hour recalls, you would have to capture the brand name of every food because, one yogurt is not the same as another yogurt in terms of the ingredients. So there's a really important research need here. I think one of the things that could be so helpful moving forward is a federal database, brand name database of foods and their ingredients so that we could actually really begin to study these individual ingredients.
I love that idea. It can be part of our real world data that got promised in yesterday's report. I love that, Susan. Kevin.
So 3 quick points. For more, you can read our New York Times opinion piece that came out today.
Oh, I didn't give that a shout out. I apologize.
Anyway,
it was great this morning.
So real quick, addressing what Fatima really eloquently said. I mean, what we really need is to kind of make the healthy kind of foods that are actually affordable and convenient and tasty and easily accessible. And there's really little motivation to do that right now because what we have is the most heavily marketed ultra-processed foods are also convenient, shelf-stable, tasty. You don't require a lot of expensive equipment or storage facilities or even skills to prepare. We need to basically be incentivizing healthier versions of those things. We have some ideas about that in our book and whatnot. The other thing I want to point out is that the thing that's also happening is that ultra-processed foods, not something toxic in and of themselves, but they're also displacing the things that Susan mentioned are the kinds of diets that we know are likely to prevent cardiovascular disease and cancer and several other chronic diet-related diseases. And then finally, I think we can't discount the fact that obesity itself is a risk factor for many of those diseases. And so even if we were only able to address the problematic aspect of diets high in ultra processed foods and promoting excess calorie intake and obesity, I think you would simultaneously address many of those, probably not all, but many of those other things that many folks think are independent of obesity. And whether or not that's true or not, I think is still an open question.
Yeah, thanks for raising that, Kevin. And it is, I think that's to me one of the really, I shouldn't use the word exciting because it's depressing, but important areas of research is that association between obesity and the chemical moderation or kind of endocrine disruptions from obesity and its effect on other long-term diseases. Let's talk a little about dietary guidelines. Fatima, you sat on the Dietary Guidelines Advisory Committee. Susan, you were at the FDA. We talk about kind of how you think about where the guidelines should go and what regulatory processes we could pursue today, given some of the areas of science that are still unsettled. And then I'll close with what individuals can do before I move to the questions.
Absolutely. Well, I want to also, I'm going to bring in Christopher, if you don't mind, actually, after I give my little spill. We spent 2 years of a lot of work, uncompensated work. I would say a minimum of 10 hours a week doing this work, delving into the literature, doing a really deep dive. And I really want to give a shout out to those people that supported us from the USDA and HHS doing that work. It was a labor of love to really delve into the literature and address questions that were coming from the public about key issues, like looking at ultra-processed food. We were the first group to really evaluate UPFs. And what we found in the literature was relatively sparse, but bringing back to this key issue of like, how do we classify UPFs? And we talked about the NOVA classification, but there are other classifications that are utilized. When I went over this, and I think this was at meeting 4, there were 6 meetings that we presented to the public. We went over the different classifications that we use, but NOVA being the most widely used classification. And we went through this idea of what we found from the literature for UPFs for both adults and children and adolescents. But there's still a lot to be done in terms of really delving into exploring this conversation and the research in UPFs in children, adolescents, and adults. There's not a lot of research, particularly here in the United States. Like I said, we were drawing upon mostly literature from outside of the US. And so I think that there needs to be more research in this field in order for us to make conclusions that will really benefit the US population. And so I think from a US regulatory perspective, that's where we need more prospective randomized controlled trials to really see really great high level, I guess, outcomes that we can really apply to the population as a whole. And I'd love to hear Christopher's thoughts, because he remembers when we had to come up with the slides to present, and I knew that I was going to be under fire when I had to present those slides, and I was like, wow, these are the slides I have to present. But Christopher, your thoughts, particularly serving with me on that in that tough work.
Yeah, absolutely. So this process of updating our dietary guidelines every 5 years has gone on since 1980, Megan. And so 2 years before they come out, this group of 20-ish scientists, supported by 30 or 40 federal employees who are just brilliant and hardworking, did this for 2 years in advance to a whole set of questions. And it's been a little sad to talk about how much we were in the back pocket of the industry and we have to do away with this. It wasn't very rigorous. Over the last few rounds, it has become more and more rigorous. In fact, Fatima and I had our hands tied many times because this is the path. It has to be incredibly transparent. Everything has to be public. Everything has to follow this guideline. And for someone who's a health professional, if it's a dietitian, if it's a governmental agency, if you're going to say something for school lunch and say, we need to make a change in school lunch, there needs to be a paper trail. Why are you saying that? Let us see the paper trail. Where is the evidence? It was all just summarized in incredible detail unless there wasn't much detail to summarize. And it wasn't like, oh, there's not enough detail here. Well, Kevin did a great study. Let's just say Kevin's study is policy. This is perfect because it almost could have been. It was such an elegantly designed study. But according to the guidelines we had of using randomized controlled trials, observational epidemiology, reproducibility, as Fatima was mentioning, precision, generalizability, risk of bias. Oh my God, it was labor intensive. Fatima and I worked more than 10 hours a week for 2 years to generate a document that was really just an advisory statement. Here you go, Secretaries of Ag and Health and Human Services. We and many others put all that we had into this. Please use this going forward. It's really a great body of evidence, and it is a published body of evidence. So anybody who wants to can still use it. But what's really frustrating is apparently the updated dietary guidelines will come out in the next month or two. And it has been explained that it will be a much simpler and much shorter version so that it will be much more actionable. And that hurts after the time that we just spent working on that with so many others to generate such an evidence-based document that made no demands. It was simply, here is the body of evidence, including, and here's the evidence that we need. Thank you, Jay Bhattacharya, head of the NIH, and others, if you want to give more funding to research for kids and school lunch. There's some obvious questions that could be answered, but very little of the NIH budget has ever gone to nutrition. So that's also a big hope of ours that can shift and more funding can be provided.
I appreciate that. And I do want to highlight kind of your description of what all of us would call it gold standard science, as well as the value of our government, our colleagues who are in government, as well as those outside of it, in terms of that expert summary. Susan, I know you are dying to comment here, so I'm going to turn to you, both for a commentary on the process, but also for thoughts about, okay, we as scientists can debate some of these definitions till the cows come home, but at the same time, there's some stuff that is actionable today. And so turn to you for a comment both on the guidelines process and some of those regulatory steps that we can take today.
Great. So on the guidelines, the only thing I'll add is that they are incredibly important because they are the foundation of federal nutrition policy. So what's in those guidelines, in the final guidelines, not in the advisory committee report, in the guidelines, that will determine things like school lunch program, federal procurement programs, provision of food. So they are incredibly impactful. That is the first thing I will say. And so when those guidelines come out, FDA and other agencies look at them very carefully and say, how does this impact our work and what do we need to do as a result of the updated dietary guidelines? So that's the first point. But in terms of your question about, okay, there's some science that is settled, there's some that's uncertain. We've heard a lot about that. I think there's enough evidence that is settled that we need to act urgently. And that's because the chronic disease burden in our country is simply untenable and we have to act now. And to Kevin's point, we don't know necessarily whether it's energy density, hyperpalatability, or what these things are. But some of the steps we can take right now can help address those, even if we're not sure what the mechanisms are. And I'll give you a few examples. The first one is that FDA has been working to lower sodium in the US food supply for quite some time and has had some success by leveling the playing field across the food industry by putting out these targets. And 70% of our sodium comes from processed, prepared, and packaged foods. So if we don't address our food supply, we're never going to be able to address sodium. So if we continue to lower sodium in the US food supply, that can impact things like the hyperpalatability that Kevin spoke about, these combinations of sodium and fat and things like that. If we can make these foods less, hyperpalatable, that may help reduce some of the reinforcing behaviors that we see. So that is the first step, first piece I would add. Also, FDA finalized the healthy definition, healthy claim for products, which is meant to drive the food industry to add more of a meaningful amount of food groups we want to encourage, more fruits and vegetables, more whole grains, more healthy oils into those foods, while reducing sodium, saturated fat, and added sugars. So what is that doing? It's changing the energy density because you're adding things like fiber. It's reducing that hyperpalatability. So there's things that can be done right now. I'd love to see the federal government use the power of federal procurement to do things like saying, if we're going to buy foods for the federal programs, a proportion of those need to meet FDA's healthy criteria, and we're going to scale that proportion up over time to incentivize the food industry to do more here. So there are tools like sodium reduction and labeling and things like that. And I will mention briefly labeling before I close on this. Labeling is a very powerful tool. When FDA mandated putting trans fat on a nutrition facts label some years ago, and the consumption of trans fat in the US declined by 80%. And the reason is because consumers started avoiding products with trans fat based upon education, and industry reformulated. So when FDA mandates labeling, that drives change in the food supply. We've seen the same thing following added sugars. FDA mandated 2015, when I was at the FDA, added sugars be on the nutrition facts label. We are seeing industry reformulate to reduce sugar in products as a consequence of that. So those are some of the steps I'd really like to see us taking. I'd like to see front of pack labeling, interpretive labeling on sodium, saturated fat, added sugars. Those can all be done to drive a healthier food supply with tools we have available now on settled science.
I really appreciate that. And I hope that there are some folks in the audience today who are listening who are regulators. In the meantime, there have been examples across the country of where cities and states have taken some action as well. And so one thing I think for listeners, if I put on my Dean of Public Health hat, is to not think that all of this, although certainly federal level changes are lovely and have society-wide impact, there's also a lot that we can do locally, which then brings me to my final formal question for you all before I start moving to some of the questions that I've seen coming in from the audience in the chat, which is around what listeners can actually do today. So many people who are on this webinar are scientists or policymakers, but all of them have families in some ways, either families by blood or families by choice. What is it that you would say that folks can do today for the kids in their lives, or for those who they care for? I'll open it to any of you. Christopher, you're unmuted. And I will note Christopher is at a conference, so if you see people walking behind him, he doesn't have some strange screensaver on. He's doing us the honor of joining us while at a conference. Christopher, Kevin, you've unmuted, and then I'll go to Susan and Fatima to close off before I go to audience questions.
I'll go last. Let Kevin go because I didn't realize I was unmuted.
Okay.
Well, I think that, there's really two buckets of things. One is, I think we're seeing in this discussion, there really is a need for more research. And I'll be a little political for the moment and say that we're experiencing the greatest kind of reduction in support for biomedical research that I think America's ever seen. And we need to kind of contact our representatives. And fortunately, it seems that Congress is receptive to that message and has rebuffed some of the president's suggested 40% budget cut to the NIH and have resisted that. But we have to be able to spend that money too and get it out to universities and places. But on a very much more personal level, I think that people who are even concerned about ultra-processed foods, what we've also discussed is that you don't throw out everything else that you know about nutrition and based on nutritional profiles, and that some UPFs can actually help you eat more non-starchy vegetables, legumes, fruits, whole grains, and limit your intake of sugars and sodium and saturated fat because they make making those foods much more easy, much more convenient and inexpensive. I'm thinking more like sauces and things that you can add and quickly heat up, rice pilafs and things like that. They're clearly ultra processed because they have some of those ingredients in food technology. But from a nutritional standpoint, the sort of traditional way that we think about healthy diets, they actually can support healthy diets. Now, those are not the ones that are the most inexpensive currently, and those are not the ultra-processed foods that are heavily marketed towards you. So you have to be a little bit selective and go out and find those foods, but they can help support a healthy diet.
Thanks, Kevin.
One of the things I always say to my patients, particularly those that come from, resource limited settings, is I have them envision what do things look like in nature. And if things look more like they look in nature, that helps them to really ascertain what is like more processed versus what is not processed. So they're like, I like Cheez-Its. I hate Cheez-Its, by the way. Absolutely despise Cheez-Its.
They're so good, but okay.
They're disgusting, absolutely disgusting. If it was the last food on earth and it was like, eat this or die, I would rather die. Just sorry for those, whoever is, I don't know who makes Cheez-Its. I hate them. Anyway, so if it doesn't look like it looks in nature, it probably isn't processed, right? So, or ultra processed. And so that's a way for people to kind of discern without really having to really do a really deep dive of what's, processed. Does it look like it looks in nature? Does it come like, but I guess like from my corn on the cob example, if you don't know that that's what it looks like in nature, then you don't know. But in other situations, there are a lot of things and people sit there and they think about it. They're like, oh, I guess that doesn't look like it looks in nature. Cheez-It is an example that people typically know that that's not what anything that bright orange doesn't really appear like anything in nature except these kind of lovely leaves behind me in this picture here. So that's a good way of getting people to understand. And then a lot of times it's really about early introduction. One of the things that Christopher and I did on the dietary guidelines with one of our colleagues is think about how can you really expose children very early in life to things to get them to have a palate that really appreciates vegetables and fruits and things early. And it's really about reintroducing these foods. Even if they necessarily reject something, if you can reintroduce these foods time and time again, then you can acclimate them to the healthier things in life and not Cheez-Its that I don't like. So I think this is a really a key thing that we can talk about. And then of course, if we can get companies to begin thinking about this, one of the things we're not going to talk about GLP-1s, but one of the things that the GLP-1 era has done is it's encouraging companies to begin to shift some of their production into thinking about healthier fare, even in the ultra processed food fare. One of the things that we've talked about is that Christopher talked about is that you can have ultra processed foods, breakfast cereals, because breakfast cereals are all ultra processed. So that's one of the things we haven't mentioned, but there are healthier cereals, maybe those things that are blue and green and purple and pink versus maybe a kashi cereal. Kashi is what we think of as healthy cereal. When people hear kashi, people assume healthy, but it's still ultra processed. And so maybe shifting our palate towards things that are healthier in that UPF domain. So I think these are things that we can do and consider to make sure that individuals that might need to consume something that's kind of on the go, kind of more ultra processed, are healthier. And so I think that's really something that we can do. And that's really what I shift my patients into, particularly in my children and adolescent, recognizing that you can't just focus on children and adolescents. When you're working with children and adolescents, you're working with the whole family. It's not a child and adolescent focus. It's really a whole family based approach to get the best outcomes.
Thank you, Fatima. Those are great actionable suggestions as well. Susan, and
So I think you've hit on most of the issues, but I think the point is that within so-called ultra-processed foods, there are better for you options and worse for you options. And even within categories, I'll choose one, soups. We know soups are high in sodium, but you can choose lower sodium options within that. It's still an ultra-processed food. It's still, available, convenient, affordable, but it may have less sodium and more vegetables in it. So within the ultra-processed food categories, making good choices. Use that nutrition facts label. And I will remind folks that FDA offers CMEs for physicians and healthcare providers on how to use the nutrition facts label in working with your patients. It's available for pediatricians and for physicians. So, read those fiber numbers, read the added sugars numbers, use those nutrition facts labels to educate. The last point is nutrition education is critically important, SNAP-Ed and others. And I'm very concerned that resources have been cut for better educating these populations on how to make those good choices in the face of a food supply that is very, very, high proportion of ultra-processed foods.
Christopher.
And then let me just build on all those fantastic comments. So the best way to find this is find something without a label. If it didn't have a label, it was a whole food. But we know that not everybody can buy all whole foods and prep them. So you can look at the back of the label and see if the ingredients look a little bit crazy. But if you were to take this ultra processed food thing quite seriously, quite a few salad dressings would be off the list because they have an emulsifier. So I want parents to think, or health professionals, instead of what? Instead of what is one of my favorite sayings these days. So I was going to make a salad. My kids don't really want raw veggies. I was going to put a yummy salad dressing on it, but oh my God, the salad dressing has an emulsifier. Okay, I'm just going to give them raw salad. Oh, they won't eat it. Well, I'm going to go get them a burger. So instead of what? So if you're just thinking, wow, this is just a tablespoon of salad dressing on a bed of lettuce with veggies, and it just made it much tastier. Keep that continuum in perspective. There's a better and a worse salad dressing. There are better and worse tomato sauces. I'm trying to think of schools here in terms of, oh my God, there's some high fructose corn syrup in that tomato sauce. Well, we have to get that out of the school. That's ultra processed. So, but it was a simple tomato sauce on pasta. That was likely a much healthier dish than what might have been the option. And maybe the tomato sauce that doesn't have high fructose corn syrup and doesn't even have sugar is twice as much as the other tomato sauces. And so in the school budget that they have right now, they can't afford the organic, no sugar, fancy tomato sauce. But tomato sauce and pasta is a simple dish that can be really much healthier than some other choices. So hopefully instead of what can help put some of the questions in perspective.
Thank you, Christopher. And I think that the instead of what all four of you have highlighted is also thinking holistically, the fact that we are balancing our food choices against many other things in our lives. And if you have to put a processed food on the table for your kid in order to be able to eat together as a family, that may be a better choice than being stressed out and not eating with them. So I'm hearing a lot of moderation in the comments that you're making. Thank you. I'm going to go into some of the questions. I will say there is no way we're going to have time to get through all the questions. They are amazing. Thank you to those of you that are submitting them. I'm going to try to put the questions into a few different categories. There are a bunch of questions around, I'm just going to kind of say them out loud. There are a bunch of questions around nutrition education. Susan, you alluded to this a little bit with SNAP-Ed, but kind of home ec, nutrition education for physicians, et cetera. So I'm going to ask about that. I'm going to ask about FDA guidelines. There have been questions about sodium, about grass, et cetera. So I'm going to ask a question there. There's a question about how to stay up to date. So we've done this amazing hour-long discussion that has only scratched the surface. So when people leave this webinar, where can they go? What are some trustworthy data sources? I'll say our Yale School of Public Health just put out an info sheet today, but we'll come to other things too. So I'm going to start with those three kind of categories, and then if we have time, I'll get into some of the others. So let's start with that first one around education. In the MAHA report yesterday, there was a call for all med schools to have nutrition education. Susan, you talked about SNAP-Ed. Maybe I'll ask one of you, whoever wants to take this topic on. I have biases. This is my value system coming to play, which is we as doctors have more than enough on our plate already, and nutrition education is not the problem, but I'm interested in the real experts' thoughts here.
And I'll jump in a little bit, Megan. And I have some experience having taught nutrition at Yale Medical School.
Yeah.
And how that worked. A couple comments. Physicians are never going to have the time to be able to do what registered dietitians do. So a key aspect here is making sure, educating physicians, and no problem with that, but really what's going to be critical is allowing those physicians to refer patients to registered dietitians who can take the time needed to really work with them to improve dietary practices. And a key aspect here is, will it be reimbursed? And so insurance has really said, well, we need evidence that nutrition consultations improve outcomes before we're going to do reimbursement. So I'd love to see more reimbursement for registered dietitians to work with consumers. That's the first point. Second point is, I like the idea of educating physicians more about nutrition, but it's hard. Not all medical schools have those capabilities. My experience at Yale says it really needs to be done by kind of PhD level scientists who can really get into the weeds on the underlying science. When I spoke to the Yale Medical Schools, the students, they really wanted to understand the details of the underlying science in a way that I could do because I had a PhD in nutritional biochemistry. But I think not all med schools have that. And so we have to think about how that education is going to be delivered to meet the needs of physicians who have strong training in physiology and biochemistry and how to integrate all that with nutrition.
Thank you. Fatima, you were going to jump in there
Yeah,
too, around maybe home ec or something like that. Yeah, go ahead.
Oh, actually, I wanted to get into the education piece, having written and published a lot of pieces on what's happening on the global scale for physicians in terms of education surrounding nutrition. And I do think that physicians have to have some basis of knowledge with regards to nutrition. I do think that RDs are going to do a bulk of the education, but I can tell you that the first person that a patient is going to ask something about what am I supposed to eat is going to be their doctor. And it's not going to be a dietitian because that's their first point of care. It's going to be their PCP, whether it's a pediatrician, their family doctor, or their internist. Whether we want it to be or not, that's another story, but that's their first point of contact. They'll say, Doc, what am I supposed to eat? So just tell me what to do. They want an answer and they want it now. And that's going to be their first point of contact. And so whether it's at a high level where we're understanding the physiology and the pathways, et cetera, which Susan just spoke to, that's one, but I think there should be a baseline level of knowledge that every doctor should be equipped with. And if we're able to understand complex physiology concerning chronic disease, then I think we should be tested on baseline knowledge with regards to what's optimal nutrition to prevent chronic disease. And I think it should be required for all medical students taking USMLE Step 1, Step 2, and Step 3 in this country.
Thank you. Let's get into FDA. We didn't really talk about home ec or SNAP Ed, but for the sake of time, let's move on to FDA regulations. Susan, do you want to talk a little bit about sodium regulations and why those? Talk to us a little bit about the history, and then Christopher, maybe if you can talk a little about the GRAS guidelines, that would be great.
Happy to do that. And FDA regulations can take two different forms. One are regulations that are essentially mandatory. The other is guidance, including guidance that is more of a voluntary nature. Industry may be expected to do that. So in the case of sodium, FDA looked very carefully at the problem of excess sodium and said, what is the best tool to lower sodium in the US food supply? And we studied the data. We looked at the variation within different categories of foods, and like a piece of bread could be anywhere from 100 milligrams of sodium to 600 milligrams of sodium. And looking at that data, we said we need to level the playing field for sodium. And so that means we need to set targets for industry on what's reasonable and what is way too much based upon the data we had on top selling products in the marketplace. So it was a voluntary system rather than mandatory, and there's a good reason for that. The reason is if you establish mandatory levels for sodium as your first step, you've got to commit resources to pull products off the market, including products from small producers, if they were to exceed that level. So we determined the voluntary was the best path forward, and if industry doesn't comply, you can always move to mandatory later. And the program has been successful to date, but it needs continued reinforcement. So I hope FDA will continue pushing for voluntary reduction of sodium in the US food supply.
Thank you. Christopher.
Yeah, so a really interesting tool was developed by David Kessler, and I'm assuming Susan has seen this, so I would love your perspective on this. I had the privilege of reading it before it was submitted to HHS, but David was the FDA commissioner back when they found out nicotine was addictive. And so many strategies were trying to get people to stop smoking or smoke less. And he's borrowing a tool from that, and he's specifically targeting GRAS. So for those who don't know, it's generally recognized as safe. It was implemented originally in 1958, and the FDA just didn't have the resources to test every single thing that food companies were putting in food. And so they said, there's going to be this list that we're just going to assume is safe. It seems to be generally recognized as safe. We have no reason to believe otherwise. And that list of 800 ingredients from 1958 is now 10,000 ingredients. And the food industry is responsible for self-regulating what is generally recognized as safe. And in a 60-page letter, a citizen's petition to the FDA, David Kessler outlined how many of those can no longer be considered safe. With the obesity epidemic and chronic disease, it can't be that they're all safe. And so the onus should be on the industry to reconsider some of those ingredients, which gets back to his additional proposal to not call this hyper-palatable foods, but hyper-formulated foods. And the formulations are all these added ingredients, many of which aren't safe, and many are really, and the name he uses for that Nova uses for them is cosmetic additives. So think, what does that bring to your mind? It's not nutritious. It's, wow, it looks pretty, or it smells nice, or it has the right crunch. It's like, oh my God, I can't just eat one. I have to eat the whole sleeve or the whole box. And I think that's what he's getting at. The ingredients that are going in for the purpose of marketing to get us to eat more of them. And that if if we could work from a regulatory point of view with the FDA using this tool that David Kessler submitted to Health and Human Services saying, I know you're trying to find a way to do this and it's going to be tough. There's lots of companies making lots of foods. Maybe if you approach this from a GRAS perspective, it could be one way to limit the number of heavily marketed, colored, flashy foods out there that are problematic. So I'm really interested in hearing if Susan has any thoughts on that or just seeing where this goes, because I haven't seen a response to the petition that he submitted from HHS or RFK Jr.
Yeah, I'm happy to address it. There's like 14 questions in there. I could spend an hour easily on this one.
Yeah, sorry.
But the petition itself, that is a process, citizens petition, to revoke the GRAS status for certain carbohydrates in the U.S. food supply. And it's refined carbohydrates. Many different chemical compounds are included under refined carbohydrates. It's not the first time that FDA has used a revocation of the GRAS status to take action. And the best example is one that I participated in, and that was revoking the GRAS status for partially hydrogenated oils, which are industrially produced trans fats. So by revoking the GRAS status, FDA needs to demonstrate that the science is there to say these are no longer recognized as safe, general recognition of safety under intended conditions of use. That's what FDA would need to demonstrate. It's a rulemaking process where they have to propose to revoke the GRAS status, or at least it's a regulatory process, propose to revoke the GRAS status, get public comment, look at unintended consequences, potential economic impact, and then finalize that. And if they do decide there is no longer general recognition of safety and these ingredients cannot be used, there has to be a long transition period for industry, right? You can't just terminate them overnight. Industry can still come back with a food additive petition and request a more limited use of the ingredients, they can use it as they want under general recognition of safety. And that's what happened with partially hydrogenated oils. Industry came back to FDA and said, we're submitting a food additive petition requesting more limited use of these compounds. FDA denied that petition and essentially banned partially hydrogenated oils. And that was based upon that science. So in terms of the citizens petition, FDA is going to have, this is a big job, Christopher, you're not going to get an answer quickly. They're going to have to look at all these refined carbohydrates. What does that science say? And this is a huge amount of work to review all that science and make a determination. And while there are timelines on citizens petitions, FDA frequently does not meet those timelines. When I was director at CIFSAN, we had 100 citizens petitions in-house. And we didn't have the people to get through all of them. And so I would just be careful about the timing there. I would not expect an answer anytime soon based upon the amount of work to answer a citizen's petition of this magnitude.
Thanks, Susan. I think that's tremendously helpful well, Christopher, I'll let you answer whether it helped you, but yeah.
Just a quick answer. I mean, I bet almost everybody on the call today will agree. Refined carbs is our biggest issue, probably. The added sugar and the refined carbs sort of are a central issue that might be the most easily recognized by people. So I think the intention of going after that was pretty wise for David Kessler to choose that. And like 40% of the calories in the US, according to our National Health and Nutrition Examination Survey, 40% of our calories come from low quality carbohydrates. So if you're going to eat a low carb diet, it would be great to get rid of the lowest nutritional quality carbs. And those are the added sugars and some of the refined grains are pretty easy for most moms, parents, and health professionals to recognize.
Thanks. Let me go. Well, I'm going to get to how to stay up to date for everybody after this, but let me actually ask a very specific question that I've seen rise up, which is about high fructose corn syrup, which we've kind of danced around, but Christopher, it goes off of what you just said. Fatima, you may want to take this. Talk to us about high fructose corn syrup. It is the boogie, right? All we have to do is put real sugar into Coke. Talk to me about what the science says on high fructose corn syrup.
Who wants it? Nobody's talking. It's the
Go
same
for
as
it,
sugar.
Christopher.
It's the same as sugar. It's a bizarre concept. So can we first talk about corn syrup? If anybody's ever baked with corn syrup and said, I wonder what that tastes like, and sort of, oh my God, that's cloyingly sweet. That's disgusting. So corn syrup is really not like sugar. High fructose corn syrup simply means that instead of being straight glucose, it's about half fructose and half glucose. That's what table sugar is. It's half fructose and half glucose. My understanding, I'm happy to hear from all of my colleagues, is it's less expensive than table sugar, and so it's easier to put in foods. And as we address the hyper sweetened palate of Americans, it's really easy to stick it in a tomato sauce or a salad dressing or something else. And again, almost like a cosmetic additive, just making it that much more attractive to have that many more bites of it. But it's just not the boogeyman that it's made out to be. It's really just a refined carbohydrate. It's really just like table sugar. And if you take it out and replace it with a cane or beet sugar, you didn't really make a nutritional dent at all.
Kevin, do you want to take that one on?
Yeah, sure. I mean, I completely agree. I think the only thing that that having the alternative version would do is increase the price, and that might actually have a beneficial effect on its own. But I don't think that that's what's going to happen, right? I think what's going to happen is that, you know, when HHS got a commitment from Coca-Cola to kind of add a cane sugar version of their products, they didn't commit to removing the high fructose corn syrup version. They basically said, sure, we'll open up a line of products that has cane sugar, and now it will seem to have the MAHA seal of approval and will no doubt be more expensive and be an additional source of revenue for the company. So I think that's the danger, right? Is that it's this question of instead of what that Christopher mentioned before, right? Which is, instead of nutritionally, there's no meaningful difference between the two compounds. What results in the meaningful difference is how inexpensive it is, and therefore how many people can afford to buy it, and whether or not it's cheaper than water for many folks, which is unfortunately the case in many places around the world, if not some places in the US. And so I think these are the more pressing issues, as opposed to any sort of nutritional question about high fructose corn syrup versus sucrose or cane sugar or beet sugar.
Thank you, Kevin. And I want to acknowledge here that there were questions about food insecurity, and I think Fatima addressed those to some extent, but acknowledging that this is a huge problem for many families across the United States and across the globe. Is we can talk about good nutrition all we want, but at the end of the day, you have to be able to afford it and have to be able to access it and have to be able to prepare it. So for final question for all of you, and this is an amalgam of a few of the questions that I've seen in the chat, is how can people stay up to date? What are some good sources to go to stay aware of the best quality science about what to feed your family or not, what policymakers should do or shouldn't do? What do you guys go to outside of reading the actual journal articles?
You know, I think that for the group that's here, I think the Academy of Nutrition and Dietetics, the American Society of Nutrition have, you know, really great bite-sized pieces of things that they'll put out.
No pun intended.
Yeah, that was interesting. I didn't even notice I was doing that. But you know, there are things that you can stay out. I see that Christopher is putting Center for Science and Public Interest, for example, information out. But I think that there are a lot of things that are coming out, and they try to, for example, ASN, the Academy for Nutrition and Dietetics, try to put out things as soon as they come out, summarize the literature, and make sure that it's there. For a physician, I use things like open evidence, and make sure, of course, when journal articles are coming out, that I'm, you know, rapidly consuming that data, because I need to be ready to, you know, deliver that out to patients and to the public. But I think that, you know, going to these sites, they're going to be able to summarize that information for you. And so I'd love to hear what my colleagues would say in addition to what I've already stated.
Thanks, Fatima. Who wants to, where do you go to stay up to date? Susan or Christopher, go ahead.
So there's 2 monthly newsletters that I get online, the Center for Science and Public Interests Nutrition Action Health Letter. You get about 10 of those a year. Berkeley Wellness Letter does something very similar. And you might not need them both because they both tend to cover really nicely. Here's the hottest topic on ultra-processed food or gluten-free, or the latest update. They'll usually sort of rotate in breast cancer, and here's heart disease, and here's diabetes, and here's Alzheimer's. And in included with the big article, they'll say, okay, and I know you're confused about those ultra-processed plant-based meat burgers. So here's the best one and the worst one based on these categories. And here's some food porn. And here's some really healthy stuff. And here's a couple recipes if you want to try a couple recipes. So they've mingled science in a big topic way with usually about a half dozen little snack bites of, yeah, here's this study and this study and this study, and don't get too upset about these, with some really practical food advice. So that's what the Nutrition Action Health Letter does. The Berkeley Wellness Letter does some of that also. And the Harvard Nutrition Source is an online place that if I don't actually go myself to those, Megan, but as soon as my audience says, oh my God, thank you for this, what can I do? I don't want to read papers. I say, well, I think this is a great monthly update. And so it's always current. If I tell them to go get a book, by the time Kevin's book comes out, it's already out of date. No, it isn't, Kevin. No, your book is actually going to be, his book isn't even out. It's going to be legendary. Everybody, Kevin has a great book coming out with Julia Bellas very soon. That's the best source right there.
There you go.
I was gonna say, Christopher, I can actually say that now that I'm no longer at NIH, right? I can do the shameless plug. Yeah, so Food Intelligence comes out September 23rd. We've tried to summarize the current state of the science as well as kind of project what's needed in the future. How do we know what we know about nutrition? How people are being misled, and what we need to do in the future for both the science of human nutrition and the science of agriculture and the planet. So hope people use that as a source, and I think it'll be up to date for a little while. We'll see.
It's going to be great.
Especially if we don't find any more science. It'll be completely up to date for... Just kidding. Sorry.
I was going to say something very different, which is we haven't even talked about agriculture and pesticides, but that's because that was not the topic of today's discussion. So
Read my
people
book.
think
It's in there.
extra. Yes. Susan, how about you?
Okay. It's hard for me because I go to the original documents. I'm trained as a scientist, and so that's where I go. But I will endorse the Nutrition Action Health Letter. I used to be on the scientific advisory board for the Nutrition Action Health Letter, and I do think they give credible, balanced information that's helpful to consumers. So that is one that I have familiarity with and I used to support.
That's great. Susan, do you want to give, since you say that you do go to the literature, and we've talked a lot today about some of the standards that we use to evaluate evidence, do you want to give people from your professor standpoint, a 1-minute primer on if they do go to the primary literature, what they should look for to assess the quality of the evidence?
Yeah, it's tricky because if you're not trained in the methodology, it's very hard to know. If you're a consumer and you're going to the literature, it's so important how the exposures are measured. We heard about that with ultra-processed foods. Different researchers do it in different ways. And so people who are in the weeds will be able to really know what's a strong, robust measure and what's not. So I think for scientists who are trained in epidemiologic methods and measurement issues, those are the 2 courses I taught at Yale. I taught measurement issues at Yale. Then I think, that's where I go because that's my comfort zone. But I think it's hard for consumers who are not trained there to understand what's a rigorous study and what's not. Even within intervention trials, we heard, which is a very robust method. But as you heard, it's very specific to the question that was asked and the population that was studied. So I think we have to, for folks who are not well versed in the scientific literature, I think they have to rely on people to interpret that in a balanced way, given all the nuances and how we do research and how that can impact conclusions.
Thank you. I really appreciate it. Well, I can't thank the 4 of you enough. I know that I have learned a lot, both from a very personal level, but also from a scientific level. And you've expanded kind of my sense of questions to answer, but also where we can act. And I really do want to highlight that balance that each of you talked about between individual level education and interventions, picking out foods that approximate what you would see in nature, looking for things that aren't brightly colored, reading those nutrition labels, right? Maybe doctors talking to their patients about the nutritional value of food, with structural or regulatory interventions, some of which may be about UPFs, but a lot of which aren't. They're really around some of those basic things that we've been talking about for decades: salt, sugar, fats, simple or processed carbs, right? And that some of these categorizations that have become trendy, as is so often true in science, just because they're a term that we're hearing a lot doesn't mean that that's actually the thing that makes a difference. And so to not get pulled in by labels that say made with real fruit, or, you know, this is made with sugar and not with high fructose corn syrup. Maybe not even by the whole grain Cheez-Its, although again, my 14-year-old son does love them, right? But to ways that we can think about structural changes as well. And I think you've given some folks some ideas about what some of those structural changes are that they can advocate for within their own school system, within their sports leagues, maybe in their city, state, or federal government. And for those who are regulators and scientists on the call, I'm unbelievably appreciative for your joining us, for your thinking through this with us, recognizing that we never have perfect answers. Sometimes we have to act despite the lack of perfection, but we'll keep trying to approximate the truth. I do want to give a huge shout out to the Dietary Guidelines Advisory Committee and all of the work that has been done by them, as well as by a number of other federal agencies that we have not mentioned today. The civil servants who are summarizing, gathering, digesting the science, again, no food pun intended, and then helping us to present it back out to the American public. I'm really tremendously grateful to all of our civil servants and folks working in the public sector, as well as to all of the scientists that are here. The last thing I'll say is that, you know, I said at the beginning that we were going to talk about nuance, we were going to debate the science, we were also going to talk about values. And I think you heard a little bit of the values that come in here. I hope you also heard that little bit of disagreement. Although we were all very polite to each other, you can also hear that there are some spaces where we would do things a little bit differently, either moving more quickly with regulation or not. And hopefully this is food for thought for our webinar attendees. Again, this is the first in a series of conversations that we're having here through NAM about health in the headlines. Our next one will be about GLP-1s on October 8th. We'll talk about cost, safety, access. If you talk about nutrition, as Fatima said, it's tough to talk about nutrition without talking about GLP-1s. So do join us on October 8th. That one will be moderated by my co-chair of this committee, Alex Azar. And if you're seeking continuing education credit, do complete the survey that's linked beneath the live stream window. Thank you all, Christopher, Susan, Fatima, Kevin. So grateful for the decades collectively. Oh, wow, Christopher, that was pretty cool. The fireworks behind you. The decades that you have spent as scientists, advocates, public speakers, frontline workers in this area. Your collective expertise is one that I know that we've all benefited from, and I'm really grateful for you sharing your time. Thanks to everybody, and a huge thanks to the NAM staff who've made this possible. See you guys soon.